Okay, on page 152, at the bottom of the page, there is that pathophys of preeclampsia, and you can kind of read through the couple paragraphs there. I'm not so worried that you have that component memorized as that you kind of understand that it's increasing that blood pressure, which is then decreasing, perfusion to our fetus in utero, and there's kind of a cascade of issues that kind of come along with that. So that is what was on the slide 102, because I'm going to guess yours shows up blank. Now, when you look at your book, there is a page that actually compares the two of them. It's on page 154. On the next slide that goes along with page 103 of your PowerPoint slides. And it's basically, preeclampsia can be diagnosed as mild or severe. Many times with mild preeclampsia, we try to keep our patients at home as much as possible. We're going to be putting them on bed rest. When they're resting in bed, we want them lying on their left side. That's going to promote the greatest perfusion to baby. We also want them doing those kick counts. Those might be ordered to be done 3 times a day. We want them to be monitoring their blood pressure on a regular basis. And many times we'll have them do daily weights at home also and report those to the physician on a daily basis also. And then remember when we talked about how we all think it'd be great to kind of lay around and be on bed rest and have people waiting on us, but remember that can be kind of seen as a very stressful time in a person's life, so we want to think about diversion, some quiet, calm activities to keep their minds busy also while they're laying and resting, to keep them as stress-free as possible, because we know that that will help to reduce their blood pressure as well. Now, a patient that has severe preeclampsia, I want you to think of a patient that's going to be hospitalized. In the hospital setting, we're going to have them on a fetal monitor. We want to think about a safe environment. They are at a greater risk for seizures, so we need to put in our seizure precautions. We want to monitor their lung sounds, reflexes, urine output, and we're going to be monitoring those signs of preeclampsia that we're going to talk about here in a minute, such as headache, abdominal pain, etc. And then you're also going to be thinking about the medication that'll be administered as magnesium sulfate, and the antidote to that one is the calcium gluconate.